If I had to pick out the three biggest ways that we've seen Brexit had an impact on the NHS over the period, really all the way since the referendum, I think finance, staffing and the supply of medicines are probably top of the list. So on finance, despite promises that Brexit would free up more money for the NHS, the money that we saved from not having to pay into the EU budget was really outweighed by the economic impact of Brexit, which by whichever estimate you use, including the estimates the government was planning with, will have amounted to tens of billions a year. So that's really contributed to a period of pretty tight funding in the NHS, and in particular to a need to really squeeze budgets back down after they rose during the pandemic, which has left NHS finances in all the UK countries in quite a tough spot. And also I think the repeated failures to fund reform in social care, which in England in particular has left that as really a neglected service that isn't working well in many ways. Coming on to staffing, again, that's one where the result of Brexit might have surprised a lot of people. I think many expected Brexit would mean lower migration and that would cause problems with the health service not having enough staff. In fact, because the UK government reacted to the first quite worrying signs of migration falling due to Brexit by really opening up to migration from outside the EU, we've had the highest migration and the highest rise in staff for many, many years since Brexit. Now that, of course, has fended off many of the immediate problems there, but we should remember that that's quite unstable. The UK government can clamp back down on migration when it wants to. We've seen that happen so many times in the NHS history, sometimes with difficult results. And again, social care has been back of the queue here and has already been hit with a big drop in migration after the government reversed course on that. And then we'll come to medicine. Again, medicines are a bit of a surprising impact of Brexit. Shortages have risen to a really worrying degree with serious effects on patients for some long-term conditions. But in fact, that's not primarily due to Brexit. We see the same effect hitting France, hitting Germany, hitting Italy at the same time coming out of COVID-19 and seeing the war in Ukraine start. But what Brexit does mean is that the UK is very much outside the systems that the EU is going to try to use to manage that. And so there's a risk that as the EU and its member states invest in capacity and new routes to get medicines in, the UK is outside of that and will find it difficult to compete when there's a crisis. I think those have been the major impacts of Brexit, and overall, they're generally somewhat difficult impacts, albeit hitting at different times. They've contributed to a difficult period for the NHS.